So we were interested to see whether or not an acute COVID infection might be associated with exacerbations of people who already had MS. So we looked at the entire Swedish population from 2015, which is possible in Sweden, so 10 million people, and amongst those, around 20,000 had MS. And so we took into account hospital admissions and comorbidity before the pandemic, before 2020, because our outcome is hospitals admissions specifically for MS. So we wanted to rule out the possibility as far as possible that it was just susceptibility. People more susceptible to infection who are more disabled because of MS were more likely to be in hospital. We wanted to see if this really was worsening of MS resulting in exacerbations rather than just an infection acutely resulting in an exacerbation because of its effect on pre-existing lesions. And so for that reason, it was important to ensure that most of these exacerbations or hospital admissions specifically for MS were mostly more than 55 days after the original infection. So what we saw was that people who tested positive for COVID but did not go to hospital, there was absolutely no increased risk for an exacerbation. But for those who were admitted to hospital for COVID, we saw that there was 106% increased risk for a hospital admission during the period up to September 2022. And this was almost exclusively amongst women, interestingly. So there was amongst women 146% increased risk of hospital admission specifically for MS after they had previously been in hospital because of COVID-19. So are we likely to see an influence of the pandemic on MS risk? At this stage, it's difficult to say. But if there is an increased risk, it will be a small proportion of the population. We don't expect to see an enormous epidemic of MS because the strongest risk factor we found so far is Epstein-Barr virus infection, coupled, of course, with genetic susceptibility. And in that case, we see in the general population, it's something like 0.2% have MS. And that might rise amongst those exposed to EBV to 0.6% for an infection. So most people will not be affected, but there may be an increased risk amongst people who have, at an appropriate age, been exposed to a severe COVID-19 infection because it has those characteristics. We know that it can have influences on the central nervous system. So we might expect that small increase in risk in the general population, but we're going to have to wait 5, 10, 15 years to really understand the true magnitude of that because of this long asymptomatic prodromal period. The work on exacerbation was preliminary. We only looked at hospital admission. We will look in more detail about evidence of exacerbations and how those pan out over time with longer follow-up. And also looking at consequences for damage to the central nervous system that's initiated by COVID infections.